My name is Monica Leslie, and I just finished the CFR course. I've heard from various other practitioners what powerful work that it can be, and some sort of deep curiosity inside of me said, go check this out. And I really did not know what to expect and had a amazing experience of the work. I certainly came prepared with a notebook and pen and thinking that we were going to have some lecturing to teach us about what this work was all about and memorize some information, and that did not happen. It was very delightful to walk into the first day and be told everything stays outside. You're going to come in here, work, and learn this material from an experiential standpoint of observing what other people were going through, feeling what was happening and shifting in my own body. You do spend a lot of time on the floor moving your body in small, simple ways and thinking to yourself, I'm not sure what this is actually doing. And then you go and stand up and walk around and feel these very interesting shifts in your own body. The effort that just starts to wash away as you're going through these movements. Your nervous system starts to relax in a way that I don't think I've ever felt mine relax before. And what I then was curious about, how is this going to feel once I actually go home and back to my real life as a practicing physical therapist and yoga teacher. I went back, got back into my normal routine. I went to do my normal workout after work one day, and any of the weight training that I had done that evening, I went up in all of the weight categories that I was doing with dumbbells, with lat pulls, with my body was moving with such more efficiency, and the muscles were contracting in different ways, and it felt so good, and the movements felt so different in my body, and it just felt right. I mean, I didn't know that there was anything else that I could be feeling. I came into the course healthy and not with any real significant complaints of pain in my body or anywhere. So it was interesting to see that even coming in from a healthy perspective, to leave with such drastic changes I was certainly not expecting, and it was really fun to be able to feel that and play with that. And it's been a little bit since I actually completed the course there, and the effects are still there. I walk differently. I hold my shoulders differently. There's no tension in my jaw. I never want to go back. It feels so good. It feels like there is freedom within my body, and mentally, emotionally, things are calm, and it's easier to be present in any situation. My reaction time is fast, but my reaction to people in conversations is a more appropriate speed of I'm receiving the information in, taking a moment to kind of sit with it, and then expressing myself versus just reacting quickly. And people have picked up on that also. So it's a beautiful course, and I think that it is literally appropriate for anyone. There were people there who had some pretty significant physical pain, some emotional stuff going on, and all areas of the spectrum. So really, your nervous system has such a powerful component of how we run our lives and sit in our own bodies and think our way, feel our way through our environments. And the CFR work just starts to peel away those layers and bring you into a space of freedom and movement and thinking and feeling. And I think that it is very important work for us to be experiencing, learning, spreading, teaching. Now I'm curious for more. I am filled with gratitude to have connected with this work. Thank you.
I'm a physical therapist, and I just finished a 4-day workshop here at CFR. I gotta tell you, after the 4 days, my body feels really mobile and pain-free. I had a lot of stiffness in my upper back and thoracic spine, and that really feels a lot better. The experience of working with my body has also made me feel just kind of an opening of my heart. And there's just a softness that I feel now that I feel that I can hopefully carry out into the world, just to be able to shine who Joan really is. So I have to say thank you to all these wonderful people at CFR that have helped me do that. So it's really different kind of work. It's very different than any of the many physical therapy educational tools that I've used in the past, and including my master's degree in orthopedic manual therapy. This just goes beyond the just the technical part and gets into more of the emotional and even spiritual parts. As a physical therapist, it definitely increases the general mobility of your body, so that you can change that to a place where you're functioning at a higher level. System from emotional stress and traumas and things like that, that I really feel that this can help release that, and while you release that, it also helps to release just the tightness in our cells, the restrictions in our cells and our tissues. I think for me that connection with just myself and the softening of my heart was pretty surprising for me, and just just being present, just feeling more connected and more present within myself, and even when you do that with yourself, you can do that with people around you. When you're present with yourself, you can be more present with everybody around you. So that's a nice little side benefit to this. So thank you.
My name is Magda Gorecka. I'm a physical therapist working with children in the Bay Area. And after our 3-day workshop with CFR, I feel like I can be close to being a child again. Having fun, feeling my body moving in all new areas that sometimes became forgotten, and feel happy, light. Well, I had a very nice change working with one of the lessons when we were able to differentiate our fingers and work with the shoulder mobility, which changed completely my shoulder girdle and how much freedom there was. And surprisingly, on top of that, there were some changes that actually happened within my upper jaw and my palate. I don't know, it just changed. It just wants to smile. It just spread out and became bigger and softer, and I don't know, some things are just surprising. Our body takes it in and brings you all the goodies you need.
My name's Scott Schaefer. I'm a physical therapist. I'm in the Santa Cruz area. I'm a clinic owner there. And I've taken this course and really learned a lot. I feel like there's a great deal I can do to creatively work with my patients and progress several who have not made any progress in other methods. Besides gaining tools to work with my patients, I feel like this has helped open up my own body and help me get more in touch with myself and my own movement patterns. I'm used to using a certain weight for an exercise, free weight, and after one day on the floor doing these movement exercises, I used that same weight and it was moving with probably 1/4 the effort. So for someone who has difficulty getting in and out of a car, it could make the difference of moving their own body weight through space in a more efficient pattern. I would say that for a patient who's fearful of activities and exercises that they've gotten in the past that have made them worse, this is a very safe way to progress someone so that they could get confidence that they'll move forward instead of backward. It actually helps people to get over their fears of movement, and that's a huge step forward. I saw people's posture spontaneously improve. I saw people with very depressed rib cage open up phenomenally, and not in a conscious way, in a more organic fashion. So there wasn't necessarily a sense of effort involved, and the person works on the activities, and then those activities work on their nervous system to help them to move in more efficient patterns. Well, just from a practical day-to-day point of view, it's a very enjoyable way to get your CEUs, and it's a way to refresh, I would say, your own or enliven and refresh your own practice. So it can give you not just new tools, but certain direction where you can be creative and use methods you're already using, but use this as an adjunct to kind of change the direction or change the angle of your treatments so that it fits the particular person better.
Hi, I'm Yoko. I'm a physical therapist working in Roseville. It's a very powerful way of finding or discovering yourself, to go deeper to a place where the potentiality of profound healing can be found. And this work gave that tangible tools for us to get there. As a physical therapist, I use the physical body as an access or entryway to get in touch with the patient's body, mind, and soul. And in a way, it's limited if we just stay at the physical level. Just realizing that there's a certain aspect of physical condition that has emotional in nature, and this work created the bridge that I can use to get to where I need to go in an efficient, profound way that I had sometimes was unable to do. This work is giving me a way to heal myself, because I really do believe that healing myself deeper helps my patients. I can only help those patients who are in need to the level that I have healed myself. I had this condition in the right low back with the sciatica, with a numbness on my foot. I have a feeling that I have an upper hand on this condition because I can see where it is coming from. So that by working on that, with this work more, that I can shift it and make the change. So that gives me sense of hope and sense of empowerment. If you feel that the technical manipulation of joints and tissue has only gone a certain amount, but hasn't got to the level that you or the patient wanted, this might be another piece that you can utilize to get there. So I'm very grateful for this work.
My name is Amy Gretchen. I'm a physical therapist and athletic trainer. I work in an outpatient private practice, predominantly seeing half Medicare, repetitive strain, chronic injury, chronic pain. Out of all the classes I've taken, and it's got to be over 70, it's one of the most profound classes I've ever experienced. It really explained why some of the things I've been trying to do just don't work, don't stick. It feels like I've got a new body, or I'm aware of my body for the first time in a very long time. And how my ribs can move, how I can move like a kid again, and the joy that brings to live life from joy and curiosity, taste and feel so much better than what I've been doing. The personal growth that's gone on and uncovering layers of strategies and compensations that I've used throughout my life. I did not know how much they were costing me until I came to this course this weekend. The supportive environment was all conducive to the process that I had to do, and I just had to be vulnerable and open to do it.
My name is Menandro. I'm a physical therapist. I work for Alta Bates Summit Medical Center. In all honesty, I wasn't sure what to expect, and in fact, I was a little hesitant. Well, it's a class, so I can earn some CEUs. And we worked on restrictions, but it was more than that. It's just more beyond the physical restriction. There is something underneath that gives you that physical restriction. Again, part of the value that I receive from it is to not try and control everything. I think now I'm a little more sensitive to the sense that I should not try to guide my kids all the time. I should let them explore. I should let them be who they are, instead of trying to create an image of who they should be. To do, we try and control what we feel the patient should be doing. We know you shouldn't bend this way, you shouldn't bend that way, and CFR then allows you to see that no, you should not be controlling it. You can facilitate it, and I don't even want to use the word guide it. You should just let it happen and then allow the patient to realize what is happening. The only thing I can say is when you first entered PT school and you were looking forward to something that was unique, that you've never had before, and that you are planning, okay, this is going to be my career. Consider the first day in PT school, I think, and that might help you with your journey. Feel lighter, feel freer, and again, there's this a sentiment that was expressed throughout the class: permission. I'm allowing myself to explore again. Where that exploration will lead me, I'm looking forward to it.
Hi, my name is Kim Blue Falvey. I'm a physical therapist working in Grass Valley, California in a private practice. I was intrigued by the science. I loved the science, because what I learned is that I came back into my own body. I just got out of my head. I got out of my head and into my body, and I know that when I experience the real integration of what I'm teaching and what I'm doing and what I'm knowing, I can share it with my patients, and I just feel like within my own body I learned that I can move in ways I didn't think I could move anymore, and it came very quickly and it came very easily, and I feel like I learned how to own that movement, and I'm excited about learning more about that and being able to share it with people. To have the experience of finding movement and performing movement and inhabiting my cells and my muscles and moving my skeleton in a way that feels comfortable and rich and full. It's pretty awesome. Possibilities are absolutely endless. To find hope and confidence. I think CFR is a way to integrate some of the really linear stuff we do with people and to integrate it into their bodies, to give people an avenue to own the movement that we're trying to help them find, for them to find it and own it and be able to take it out and be functional with it.
My name is Kristen Lindstrom. I'm a physical therapy supervisor at Kaiser. It made me more aware of the interactions and the communication that I have with my children will affect how they hold things later in life. A shift in my whole being and sense of being able to just, first of all, stay relaxed, not be in that, I feel like usually I'm in that sympathetic state all the time, and when I'm with them, to have a calmer way of communication and to just to let them know that I'm really listening to them, that I'm not trying to multitask and do a bunch of other things while they're trying to get my attention, but to really just give them some individual focus and give them my presence.
Week of CFR training kind of combines the best of a lot of the worlds that we have learned. Some of the closed chain education, movement science, as well as some things I haven't been aware of, but how the brain learns. So it's the neuroplasticity part where the brain learns these new motor patterns or relearns motor patterns that we should have known or knew as children, come back and resolve pain and dysfunction that surgery and strengthening or stretching could never do. So the changes that I personally had was surprisingly a better sense of well-being from top to bottom, an awareness of my body and space, how I stood, how I moved. You know, surprisingly, it sounds crazy to say, but I felt a youthfulness in that I could go out here and surf right now and be fine, with good balance and feel like I could do it as a 20-year-old. And absolutely, I'd recommend all therapists come and experience it. Seems the first thing is you need to experience it yourself, or I needed to experience it so that I could take it and use it outside in the world.
I'm David Lee. I'm a physical therapist, and I just completed a CFR course in neuroplasticity. I came to this with several accidents and trauma. My breathing was affected to the point where my hands were always numb, cold. I would have shooting pain. I would wake up in nightmares with thinking spiders were crawling all over my hands and be terrified. I came here actually just to complete my continuing education for the California license requirement. It had me do things, move in a way that I haven't done in probably over 20 years. And just the first relief within the first few days of being able to see that I could breathe, I could move, that the numbness in my hands were dissipating, and now the complete 5 days later, I'm not feeling the numbness in my fingertips anymore, is miraculous. Being someone who, as a physical therapist, went to physical therapy now for close to 7 to 8 months, because my injuries were so severe I could not practice anymore. And to come and in 5 days to get nearly 80-90% of it resolved. One of the biggest things about this training is I view like a rebirth in how your brain works, and an understanding of what it makes it work better. So I'm excited and I'm thrilled and I'm energetic to get ready to go out and integrate what I've learned.
Two days after the CFR seminar, David Lee writes this in an email. I went to the CPTA convention in Oakland. The drive from Esalen to Oakland took 3 hours due to an accident. I arrived happy and shocked with no pain or numbness in my hands. For as long as I can remember, any trip over an hour would result in pain in my hands and fingers. The next morning, I rode as a passenger home for 10 hours. Again, I arrived actually feeling comfortable without hand or finger pain. Sunday night, I happened to sleep on my left side, which is very unusual. I avoid this position because it usually causes pain after 15 minutes. This time, I fell asleep without feeling pain. I awoke with my left hand numb, but once I moved it and turned to the other side, it was gone within a couple of minutes. Today, I awoke and don't remember having to pick the side to sleep on and then wrap the sheets to keep me from turning to the wrong side. Again, I'm still completely pain-free, fingers and hands. I am getting back into the swing of things, and it has not been as hard as I thought. When I am feeling better, I am more productive, and work is less of a chore. My brain is hungry to continue to learn more. 1 week later, David writes, Today was a major test day. After driving over 150 miles in one day, up to 3 hours of driving with stop-and-go traffic in rush hour, all over LA County, usually I would be in pain with my hands and numb. Instead, I'm home now, without numbness or pain. It is so hard to believe that I'm still going now with no hand or finger pain.
My name is Peter Sue. I'm a physical therapist. I come from an orthopedics background, and I found my way to CFR through frustration at work. I mean, the only way I can describe it is when you're running in the schoolyard playing with your friends and you're climbing fences and climbing poles without any restrictions or expectations on your body, and it has brought me back to that place. And so, I have a whole new complete awareness of my body that I haven't had in a long time. And I think, with this chronic pain population, these people, I feel, do not have awareness of their body. And basically, physical therapy is you're changing movements, you're retraining people's movements, and where does that come from? And it's the brain. And so, this is hopefully going to be a crucial part of my practice and how I approach patients and how I change movements. And it might flip things upside down a little bit, but it's I feel like it's going to be very effective. So I recommend CFR training for people who want to make a change in the brain.
One week after the CFR seminar, Peter Sue writes in an email, I visited my sister and her family, and she and I had a great bonding session. We had a very honest conversation about life and things. We haven't had such a talk in a long time. So the first 2 evaluations I did back at work were, of course, chronic pain. I felt I was very much more present and aware than usual. Both were very receptive to me. One of these patients became very emotional during our subjective. I also noticed a new softness I had towards the objective evaluation, both in my handling skills as well as my instruction. It felt a lot slower than usual, but not in a timekeeping way. Thank you for everything that you've done, your help, your approachability, everything.
Hi, I'm Barbara, and I came to this CFR class not knowing too much. I did expect to have a lot of joint mobilization. I am a physical therapist. I got a lot more than I expected. This modality is so powerful. It gets down to a cellular level. It changes the whole brain, the patterning. You just know it works, and it's great.
In normal PT practice, I had a partner. We had a clinic with aides and office manager, and I just wasn't getting the results I want. Was kind of a Con Ed junkie. I went to a lot of seminars, and I thought, well, I just need another piece of information. If I just had one more piece of information, then I would get the results I wanted. And I just saw other people not getting that great of results either. So I began to accept it as the culture. It was just the PT culture. Some people got better, some people didn't. Maybe there was a personality issue, who knows. And then one of my patients, a really complex work comp patient, came in for quite a while, couldn't really help her, finally said, okay, go ahead, I guess, the docs are right, you're gonna have surgery. And I hated that answer, but what was I gonna do? I knew I wasn't helping her. And right before her surgery date, she got connected with this woman, Harriet Goslins. She had amazing changes. I couldn't even believe it. And I said, take me to your leader. How does this happen? And my business partner and I ended up going down to Laguna. And I thought I was gonna pay $600 and get another weekend's worth of notes, and maybe it would help. And I could not believe it when my business partner got off the table and did the retest from the pre-test. I literally cried. I literally cried because I knew there was no way I could get those kind of results in an hour and a half. And it was from that point on that I said, I don't care what it takes. I don't care that you've just done your second training and you're not doing another training. Somehow you were going to train me and teach me how to do this kind of work. And I tell you what, it changed not only my life, it changed how I mothered, it changed my relationship with my friends, it changed the way I saw my faith, and it changed the way I did business too, because I've completely changed over to a cash-based business, and I'm happy to say that I like it a lot better than working in a third-party payer system.
I'm Brad, I'm a physical therapist. I just finished a 5-day class in CFR. I find it an extremely powerful tool, movement patterns through awareness, which can teach any client or me a totally new body awareness, which helps range of motion. Teach your clients to increase their range of motion through a gentle movement that is permanent and very long-lasting. So I would recommend that you give this a try. The methods have been around for a long time, but I think we're getting a new awareness of it now, and as physical therapists we owe ourselves to try this tool.